Hello and welcome back. This is part 3 of the final segment of our Q&A on COVID-19 and children living with rheumatic disease. I'm joined again by Dr. Pavla Walsh, consultant paediatric rheumatologist, who is responding to questions sent in from our consumers. This segment discusses comorbidities and the infection control issues on the background of COVID-19 in paediatrics. First question, in the last 6 months, my child has had a lot of surgeries. Does the general anaesthetics as well as antibiotics, anti-inflammatory medicine weaken my child's immune system? Also, is my child safe to return to school or should they remain home for the distance learning?
Now, I'd be quite curious to know what the operations were for, of course. So a child who has chronic disease of some type, depending on what is wrong, may well be at higher risk, but it depends what the operations were for. General anaesthetics several months ago would not in and of themselves be a risk for COVID-19 infection, no. Hanging around a hospital, if that's what's going on at present, might be, because of course there may be sick people in the hospital with you. The anti-inflammatories we talked about in the first segment, but the summary would be, at this point, we don't have evidence that anti-inflammatories are in fact a risk factor for bad disease if you catch COVID-19. And antibiotics, likewise, we have no evidence to suggest that use of antibiotics, either at present or in the past, is associated with any risk of a bad outcome in COVID-19 infections.
Okay.
Now, the bigger question and the very hot topic is about return to school. The summary would be, at present, we don't believe the children with the inflammatory diseases or on the medications to treat them are considered to be higher risk. Therefore, at the moment, we now think if you would have otherwise chosen to send your child to school, we don't think there's a good reason to have to keep them home for the sake of their medical condition. So if you would have otherwise sent your child to school in the current environment, but they've got arthritis, the arthritis is not a reason to have to keep them at home right now. There may be other things that lead you to have to keep your child at home, but it shouldn't be the arthritis.
Okay. Should children taking immunosuppressant drugs go to school? Are they at an increased risk of infection?
And again, as we say, as far as we know, as the story is playing out, they don't seem to be at higher risk of infection, or if they get infected, they appear to not be having a higher risk of bad outcomes.
Okay, another one. Should our children wear masks if attending hospitals for infusions? If so, what type of masks?
Good luck finding one. So again, we sort of touched on this. If your child is going into hospital for an infusion, it assumes that they're actually feeling well at the moment. And so therefore, there's no specific reason they should have to wear a mask. Now, I would strongly encourage you to bring along a supply of hand sanitizer with you, to bring along a packed lunch if you're going to be there for long enough, to really enforce strict hand hygiene with them, not bring along any siblings, etc. So only bring the person who needs the infusion. Don't touch everything on your way. Wash your hands before and after you touch every surface that you can think of. And before you leave again, wash the hands. But we wouldn't specifically recommend wearing a mask at this point, no.
Okay. Our final question, is there a bigger risk for young people with psoriatic arthritis and inflammatory arthritis if they contract COVID-19, and should they remain home in isolation rather than attending a supported workplace with people with disabilities?
So as far as we know, no, there is no specific higher risk in psoriatic arthritis or in any other inflammatory arthritis, or even in diseases like lupus or dermatomyositis. If your supported workplace is able to comply with the COVID-19 directives for social distancing, then it may well be appropriate to return to work, yes. So by that, there's a number of people per surface area of the available floor. I think it's 4 square meters per person. You need to be able to maintain the 1.5 meters distance from the next person, etc. So if it's a very crowded location, it may not be appropriate that that workplace is open. The workplace should be able to offer good access to hand hygiene measures and so on and so forth. But having psoriatic arthritis wouldn't be the reason for the person to not go to work.
Okay, well that concludes our Q&A session. Once again, I'd like to say thank you very much to Dr. Walsh for taking time out to answer these questions and provide us with an overview. And I'm sure that the people out there would have gained lots of information from that. Once again, thank you very much.
Thank you for having me.